At the age of 38, I suffered a major heart attack. Somewhere in the medication, I was given a medication called streptokinase. Somewhere in that process destroyed my central vision. I'm legally blind.
I was being actually diagnosed with lupus, and I had night sweats, fevers 102 to 104, going weeks on end.
At about age 5, my parents and I were sitting in church, and we looked down at my fingernails and my lips were blue. I'd had some trouble breathing that morning, but they took me to the hospital, and it was diagnosed that I was having asthmatic problems.
I really didn't know how I'd ever work again. I had no strength, no energy, no stamina, no endurance, and I had absolutely no idea how I could ever make a living.
It wasn't until just a few years later that I started to develop allergies.
Had kidney malfunction, liver malfunction, crippling arthritis, and rashes over my entire body.
I started to develop bowel problems. Never found anything wrong. Just go ahead and give her this medication, these stool softeners, and things will be just fine. After that, I developed kidney problems and had constant kidney infections and kidney gravel.
I was put on a massive amount of medication. 4 different blood pressure pills, 4 heart regulators, 2 Zantac a day, and carried nitroglycerin everywhere I went, and frequently needed to use that to make sure I wasn't having another heart attack.
It was at that time we were seeking medical help from all the specialists, and they offered me many solutions such as steroids and that kind of stuff, and I really didn't want to go that route.
Later I developed a more severe form of allergies where my whole body was covered with eczema from head to toe, backside, upside, you name it. And as the years went by, more and more allergies appeared, to the point where I was getting 4 allergy shots a week, and now I'm drinking Benadryl out of a bottle, and I'm taking medication for my kidneys, and spending every Wednesday of my adult life at a dermatologist with my hands under ultraviolet lights, wearing little goggles.
I had a second heart attack, and my wife was driving. I can still see her with tears running down her face. 6 little girls, scared to death. I was really afraid that day that I wouldn't be able to raise my own kids.
America, the land of the free and the home of the sick and tired. It doesn't really have a nice ring to it, but it's true. In only semi-loose terms, we're a nation of overweight people spending more money than ever on health care and getting collectively sicker each year. For instance, diabetes currently affects 15 million people and is the 6th leading cause of death among Americans. Experts predict that in just 10 years, the number of Americans with diabetes will about double. Heart disease is our #1 killer and is largely preventable through diet, exercise, and other lifestyle changes. But 22 million of us struggle with it. The June 2000 Harvard Health Letter suggests that atherosclerosis, the first step toward coronary artery disease, heart attack, and stroke, can begin at age 9. Cancer, the #2 killer of Americans, claims over 500,000 lives each year. Just recently, it became the #1 killer of Americans under 85 years old. This after Congress declared war on the disease in 1971. Since then, we've spent $2 trillion on conventional cancer treatments and research, yet it continues to grow unabated. Money hasn't proved to be an effective barricade to disease. As a nation, we spent a whopping $1.5 trillion on healthcare last year alone. In fact, the U.S. spends more on healthcare than any other nation, but we rank 72nd in healthcare quality. Not a good return on investment. To top it all off, we're getting bigger all the time. 30% of American children aged 6 to 11 are overweight and 15% are obese. Obesity among adults has doubled in the last 25 years, and it has tripled in adolescence. While unsightly or uncomfortable for some, obesity is also dangerous. Excess weight has been linked to diabetes, heart disease, cancer, and a host of other top 10 life-threatening illnesses. We're losing the battle. Why are we in such a state of unhealth? Consider these possible factors. A, we're overeating. Fast food restaurants in every town USA offer supersized value meals and largely unhealthful choices. Likewise, all-you-can-eat buffets are part of Americana. Studies show that adults today consume 570 more calories per day than people did in 1970. That's like a big gulp and a candy bar. B, we're eating non-nutritive foods. Today, 95% of our food is processed. Lots of refined flours, white sugar, white rice, etc. Much of it contains questionable, if not harmful, substances such as trans fats, artificial flavoring, coloring, added sweeteners, preservatives, and dyes. We've moved away from raw vegetables, fruits, and whole grains to convenience land, where everything we eat is canned or packaged and ready to go off the shelf.
My lunch was the envy of every child during school because I would have the chocolate milk, the bag of Fritos, the Hostess Ding Dongs, and a grape jelly sandwich. Mom would come home from work and everything we ate was out of a box or out of a can. My body was saturated with this type of food, and never, ever do I ever remember drinking water. We drank pop and Kool-Aid. That was what we drank.
C, both A and B. We're overeating junk. Chew on this. Each year, the average American eats 120 orders of French fries, 150 slices of pizza, 94 six-packs of soda, 176 pounds of sugar, 45 large bags of chips, and 190 large candy bars. If that's average, I'd hate to think what the above-average person is eating right now. These so-called foods contain little to no nutritional value. The truth is, we're eating more than ever, yet nutritionally bankrupting ourselves. Other factors can play a role. Things like stressful lifestyles, farming methods, and a toxic environment also contribute to our sorry state of affairs. Stress can make digestion a lot more complicated and less efficient and make us more susceptible to illness. And toxins that surround us, from gasoline and hairspray to plastic wrap and factory pollution, are penetrating all corners of the globe, including the cells of our bodies. Yes, we're in a state of health crisis, but I'm here to offer hope through education, to bring a ray of sunshine to a darkening world.
Symptoms disappeared, and as the years went on, I got better and better, where today I'm a kickboxing instructor and teach a step aerobics class, and I'm able to handle stress, and I don't take any I don't take any medications.
It was about 8 months later, and I was on a telephone call one day, and I looked down and there was skin on this finger, and I hadn't seen skin, literally skin on my body, for many, many years, and it gave me such great hope. And it was only 1 month later. So that was just the beginning. After 8 months' time, I saw the skin on this knuckle, and within 1 month, my body was totally clear of the eczema. That I am now 52 years old. I do not have asthma and have not had asthma ever since then. I don't have any allergies, and at one point, that handful of allergies in my youth turned into 189 allergens out of 200 that I was tested for, and it was 4 shots a week. So I have no allergies, I have no asthma, I have no bowel problems, I have no kidney problems. I'm healthier now at 52 than I ever was in my youth.
Within 9 months, I really started to feel better. Within 9 months, I was off all my medication with normal numbers. Now my cholesterol had gone from 380 down to 191. My triglycerides had gone from over 500 down to just right at 100. My good cholesterol had gone all the way from a low of 22 up to 45. Everything had changed, and I felt good, and I'd lost about 20 pounds.